Hello, my name is Dr. Alexander Lyon and I'm a consultant cardiologist at the Royal Brompton Hospital in London, where we set up our cardio-oncology service back in 2011. And I had the privilege of being the co-chair of the first ever European Society of Cardiology Guidelines on Cardio-Oncology. We're here in Cape Town in South Africa for the Global Cardio-Oncology Summit, and it's the end of the first day. We've had a whole range of fascinating talks. We had a whole session dedicated to the guidelines. One of the key messages is that these European Society of Cardiology guidelines aren't just for cardiologists, they're for oncologists and hematologists. And we talked about how to raise awareness so that you can access them. They're open access at the European Heart Journal, and also there's an app, the ESC Pocket Guideline app, which if you go to, you can have that free of charge download and have the Cardio-Oncology guidelines on your phone. And that's really important for oncologists and hematologists, because I spoke about a baseline cardiovascular risk calculator for a range of different cancer therapies, the common ones that you prescribe that have the potential to cause heart failure. These are drugs such as anthracycline chemotherapy, the HER2-targeted therapies for HER2-positive breast cancer and HER2-positive GI malignancies. There's also one for multiple myeloma, for RAF and MEK inhibitors, and also for the drugs used to treat chronic myeloid leukemia. And finally, one for VEGF tyrosine kinase inhibitors, which of course are used for a whole range of solid malignancies. And I showed how you can use these risk calculators that take about 60 to 90 seconds to then identify who's at highest risk for future cardiovascular events. And if you've identified those patients, then there's a pathway for them to be seen by the cardiology team, or in some cases it's by GPs if primary care can assess their 10-year vascular risk. If they're a prostate cancer patient being prescribed androgen deprivation therapies, which we know have the potential to cause diabetes and accelerate coronary and vascular disease. And that's where we really want a collaboration with primary care to be able to optimize who needs their risk factors managed. There was a whole session on survivors with a great talk about pediatric cancer survivors once they're adults and how they need to be followed up because of the very high risk of long-term cardiovascular problems if the child was treated with either anthracycline chemotherapy or radiotherapy to a field that involved the heart. And then the day finished with an excellent plenary lecture from Dr. Roland Illing, who's the Global Medical Director for Amazon Web Service. This is about the future of digital health and how, as we all move to more and more data, how can we manage this and the different systems that countries or regions or hospital networks can use to handle the data to improve care. And for cardio-oncology, we're already thinking about this and the different ways in which we can get the serial data analyzed and use agentic AI and other technologies to improve care. Because the real key here for us is the win-win of reducing cardiovascular disease, but also improving cancer outcomes. And what we've also heard is cardio-oncology services prevent interruptions of evidence-based cancer therapy, and by doing that, we're improving cancer outcomes. So if you're wanting to improve the outcomes for your patients, as well as all your wonderful new treatments, we've got to think about their safety and how we can ensure and maximize the number of patients who can benefit and get their optimal cancer therapy safely.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.